Based on the public health stream, I'm going to present on the topic of the impact of moderated WhatsApp text messaging for improving maternal and newborn referral outcomes among health facilities in Lweendo province, Zambia. I may call upon Lweendo for present the paper in the public health stream. Thank you, Mr. Lweendo, for sharing your video. Can you talk something so that I can check the audible also?
Greetings.
Thank you so much. I can listen your voice. Now, can you share your screen?
Thank you very much. If you may allow me, due to instability of my network, I may actually switch off the video.
Okay.
So not interrupted in the presentation.
Okay, from your end, you will share, right?
I will share from my end.
Okay, please share the screen. Okay, the screen is loading now. So loading. Okay, I got the screen now. Thank you so much, Dr. Lweendo. Please carry on with your presentation now. You can click on slideshow. Click on slideshow, please.
Thank you very much.
Thank you so much. Please.
My name, as shared, is Dr. Lweendo Munzele, and I am a medical doctor who is practicing in the rural area of Lweendo province, Zambia, as a district health director. So my work really involves public health. The topic that I'm going to present is the impact of moderated WhatsApp text messaging for improving maternal and newborn referral outcomes among health facilities in Lweendo province, Zambia. This topic actually came out as one of my research topics during my study of public health with Texila American University. And I must mention that it was actually submitted as part of my partial fulfillment of the academics. It was developed as a result of, an argument on a WhatsApp group, which we developed in Lweendo in 2016 to assist us in terms of communication when it comes to maternal referrals within our province. So a lot of arguments came up if really this group served the intended purpose or it really didn't, and maybe we needed to, to forget about the group and go back to the old ways. So this research actually was trying to actually answer that question if really we needed that group, looking at also issues to do with our maternal health problems in the province. So maternal and neonatal mortalities are a major public health concern within Zambia, the consequence of which contribute to an estimated 183 deaths per 100,000 live births. This is according to the Zambia National Public Health Institute 2021. Despite the country having experienced a 50% and a 40% reduction in maternal mortality and infant mortality between 2007 and 2018, neonatal mortality rates increased from 24 to 27 deaths per 1,000 births. This is according to UNICEF data 2019. While evidence has shown that innovative strategies such as using mobile health applications can rapidly reduce and improve maternal health outcomes, unfortunately, the innovation's practical use is biased towards chronic conditions as opposed to emergencies and acute conditions. Thus, Lweendo Provincial Health Office has implemented the moderated WhatsApp messaging for obstetric and gynecological emergencies since 2016, as I earlier mentioned. This intervention was actually designed with the potential to manage the third delay in obstetric care, that is, receiving the appropriate quality care once a pregnant woman reaches the facility. Ideally, the referring facility would post a text to inform the receiving facility or information critical to the patient before the patient even reaches the facility. This was envisaged that it may help improve maternal outcomes between the referring and receiving facility by ensuring that the receiving facility prepared well in advance before the pregnant woman arrived. However, there has been no study conducted to assess the efficacy of this intervention. Hence, the current research aims to assess the effectiveness of the moderated WhatsApp text messaging for improving maternal and newborn referral outcomes among health facilities in Wapula Province, Zambia. The main research objective was to determine the impact of moderated WhatsApp messaging application in improving maternal and neonatal referral outcomes in Wapula Province. The specific objectives was to determine the impact of moderated WhatsApp messaging in improving maternal and neonatal referral health outcomes. The second one was to explore the factors that could contribute to the maternal or neonatal patient receiving adequate and appropriate care once they reach at the receiving facility. The research question was, what would be the impact? What is the impact of moderated WhatsApp messaging in improving maternal and neonatal referred outcomes in Wapula Province? The methodology. The study used a mixed method which involved both quantitative and qualitative data to further give more information to the quantitative data. The quantitative used a retrospective cross-sectional design from 2017 to 2020, which was conducted on obstetric and gynecological data stored at Mansa General Hospital. The study population included clients who were referred from facilities within Wapula Province to Mansa General Hospital, obstetric and gynecological department. The sample size was 360. It was calculated using a sample size calculator, which is an electronic platform that is Creative Research Systems 2021, and the following parameters were used. The total population was 8,688 patients who were referred to Mansa General Hospital Obs and Gyn Department from 2017 to 2020, with a confidence interval at 95%. The sample size required was, as shared, 368. The sampling technique which was used was stratified random sampling. The patient records were grouped into strata based on years. That was 2017, 2018, 2019, and 2020. And in each year, a total of 92 patients were selected randomly to make the total of 368. The data was extracted from the District Health Information System version 2 and referral registers for the said period. Data analysis for quantitative approach used SPSS version 25. Demographic traits were analyzed using descriptive statistics and presented in form of tables and graphs. In addition, impact was assessed using health outcomes from referrals that used WhatsApp messaging from those that did not use the platform during the period under review. The qualitative approach used the phenomenological study design. The focus group participants' interviews focused on subjective experiences and understanding the structure of those lived experiences while working in obstetric and gynecological department. The population included those members of staff that had worked at Mansa General Hospital or were still working at Mansa General Hospital, specifically in the obstetric and the gynecological department. For the focus group, it included 2 focus groups. Each focus group comprised of 8 participants that were selected through purposive sampling, as I earlier mentioned. The data was collected through in-depth interviews, and a questionnaire with open-ended question was used to conduct the interviews. Data analysis was done using thematic analysis approach. The study closely examined the data to identify common themes, topics, ideas, and patterns of meaning that came up repeatedly. Here are the results. Social demographic traits revealed that Mansa district cumulatively had the highest total number of referrals at 74.2% and 273, while Kawambwa district had the lowest recorded number of referrals at 0.3% and 1 recorded and communicated via the WhatsApp platform. Additionally, only Lweendo and Chembe district recorded maternal mortalities within the period under review, 1 in each district. On the other hand, Mansa district cumulatively recorded the highest number of neonatal deaths at 80.4% and 37, while Mirenge and Kawambwa had recorded no deaths. Maternal mortalities. The figure shows that there were more maternal mortalities recorded from cases repaired with no prior WhatsApp messaging compared to cases repaired with prior communication, with 2017 recording the highest number of mortalities at 32.9% and 26. On the other hand, cases repaired with prior WhatsApp messaging, texting, or phone call had recorded no mortalities except for 2019, which had 2 mortalities. Neonatal mortalities. The graph indicates that a total of 250 and 46 neonatal mortalities were recorded from cases repaired without and with the communication intervention, respectively. It is also important to note that mortalities where the communication intervention was applied dropped from 39.1% N18 in 2017 to 10.9% N5 in 2020, respectively. Looking at the factors leading to maternal or neonatal patients receiving inadequate and appropriate care at the receiving facility, the focus group discussion was used to respond to this question. Most focus group discussion members had observed that prior communication via WhatsApp by the sending facilities was critical in adapting care to each specific case. It was reported that the model of emergency communication before the intervention was poor. Focus group discussion 1, 2, 5, 6, and 7 asserted that emergencies communicated via phone calls only made it difficult to reference what was said if the narrative escaped memory. Similarly, FGD3 and 10 intimated that while referral letters sometimes accompanied the patient, often the quality of handwriting made it difficult to comprehensively understand the message. Additionally, focus group discussion 4 and 9, members of staff at the receiving facility shared their experience by noting that there was very minimal to no communication prior to a referral, that in many cases would just receive patients with no prior communication. With the introduction of modulated WhatsApp as an intervention of choice to improve communication since 2016, the focus group discussion 2, a staff at the receiving facility observed that the intervention was a good move, as it helped staff with the sufficient reference information to prepare adequately prior to receiving the emergency. In adding their voice, focus group discussion 3 and 9 intimated that it was a good move that has led to significant reduction in maternal and neonatal mortalities, as it has arrested the malaise of poor communication, a huge contributor to poor outcomes. In the same vein, FDG 4, 6, and 8 said, WhatsApp messaging has really helped us a lot in the sense that it allows us to prepare effectively well in advance before the patient arrives. On the other hand, FGD7 made a very good observation that while modulated WhatsApp was very useful, it should be accompanied by a phone call just in case someone is offline. The discussion. The research findings in the 8 districts in which the sending facilities were located showed that there were fewer maternal and neonatal deaths among referrals that used the communication intervention platform compared to those that did not. Maternal mortalities resulting from referrals used the intervention reduced by 99.4% from 2017 to 2020, while only 0.5 mortalities with the sample population. On the other hand, maternal mortalities from referrals without the intervention only reduced by 78.5%, with 21.2% recorded mortalities within the same period. Similarly, in terms of neonatal mortalities, the findings show that there were fewer recorded mortalities from referrals that used the intervention compared to those that did not. These are some of the references that were used to conduct this study. In conclusion, maternal and neonatal health continues to be a national and global priority, given the fact that both are still touted as public health challenges. They remain aspirations in the Sustainable Developmental Goals. Therefore, interventions that seek to promote maternal and neonatal outcomes should be supported and extensively researched for their efficacy. The research findings showed that moderated WhatsApp messaging application had indeed a positive impact in improving maternal and neonatal referral outcomes in Wapula province of Zambia. Allow me by share of screen just to acknowledge the support I received from the people that have just projected, during this work, as it was not only a one-month show. I thank you for your attention. I submit.
Thank you so much, Mr. Lweendo. Dear participants, please raise questions in the chat box so that we can ask questions and Mr. Lweendo will answer on that. So we have one question, sir. Who initiated the moderated WhatsApp message, the referring health facility? If this intervention is implemented to scale in Zambia, are we going to have similar results? What is the maternal and nocturnal figures for Zambia before and after the intervention?
Thank you very much for that question. I will start with the first question. So the referral is the message in the group, in the moderated group, is initiated by the referring facility. Immediately they make a decision to refer and they put the client on the ambulance. As the ambulance is moving, the facility in charge informs the receiving facility via the group to say, we have the case of this client and these are the vitals, this is the condition we are suspecting, so that the receiving facility can actually prepare according to the information they receive. Then the next question, if this intervention is implemented to scale in Zambia. So this intervention was only conducted not in the whole Zambia. This intervention was only conducted in 1 out of the 10 provinces of Zambia. And the maternal deaths reduced in this province, just in this same province, from about 40 to 20 maternal deaths at the end of 2021 per year. So generally, the maternal deaths also for the country scaled down from 183 per 100,000 to about 140 per 100,000. So this intervention was only applied to one region, of which through the works of this, we may expect that maybe this intervention can be scaled up to other regions of Zambia. Thank you.
And dear participants, we've opened poll for Dr. Lweendo. Please poll for Dr. Lweendo for the presentation done on the topic. the impact of moderated WhatsApp text messaging for improving maternal and newborn referral outcomes among health facilities in Lweendo province, Zambia. And if you have any questions, dear participants, please type the questions in the chat box, Q&A box. Dear participants, please raise question in the chat box so that we can get the answer from Dr. Lweendo. And also the polling session is open now. Okay, Dr. Lweendo, you have a question like, however, how to take care of areas, especially rural locations, without network and worse affected by maternal and neonatal mortality?
Thank you very much for that question. Actually, when you look at challenges that are likely to be affected by this, it actually includes issues to do with poor networks. It includes issues to do with loss of gadgets, the mobile phones, the ability of the members of staff to actually buy those phones, the cost of bundles, to load those phones with to actually be able to communicate. So if this intervention was to work actually successfully, there would be need even in terms of support towards addressing these challenges. I submit. Thank you.
Thank you, Dr. Lweendo, and thanks for your time. Have a nice day. You can be converted as a participant now, and we can call upon the next presenter. Thank you so much for your presentation, Doctor.
Thank you very much for the opportunity to present, and thank you everyone for your attention.
Thank you, sir.